Alrighty, if you have arthritis, knee pain, osteoporosis, headaches, or are plagued with chronic pain, our next guests are here for you. They treat that and much more using stem cell therapy. So what exactly does that mean? Well, here to tell us exactly what that means, Richard Hathcock and Alan James from Primary Medical Partners. Good morning to you.
Good morning, Amy.
Thank you for joining us.
Thank you for having us.
So tell us, first of all, what conditions does stem cell therapy help?
The launching pad for what we brought into our clinic is mostly the osteoarthritis. They have knees that are in need of replacing, hips need replacing, chronic shoulder pain, spine pain certainly, top of that list as well. So that led us to figure out what can we do for the community that might help this long term as opposed to just kicking a symptom further down the road with a corticosteroid, a pain medication, a nerve block treatment, things like that.
Fabulous. And that is very, as you're sitting there talking, I'm like, wait, there it is. There it is. So how does this help? How does this, and what does it involve, I guess?
Well, what we're doing, we're bringing in umbilical cord stem cells. An easier way to think about those is the non-controversial stem cells. These are healthy babies that have gone home with mom full term. Stem cells are screened and made sure that they're clean through the tissue bank system like lifeblood. Then the patient can come in after an examination to determine what the most logical area for a stem cell treatment would be for them. It's one injection. And
that's what I was going to ask. How many?
One injection as opposed to a surgery followed by 4 to 6 weeks or even 8 weeks of physical therapy and downtime. This is one injection. The stem cells get in there. They do what they do for the next 3 to 6 months, and you should have a new internal structure, the knee, the hip, the shoulder, the spine.
Wow, and this is really some unbelievable technology that is being provided by you guys, and I can only imagine that for folks in pain, I mean, it comes as welcome relief.
It has. Our clinic has always been geared toward pain management, with therapies, the medical side, the physical therapy side, the chiropractic side, but with what this is allowing our office to do is finally solve the problem for the patient.
Wow, and you got a great event coming up, right? Tell us about that.
We're having a dinner to discuss all these questions and answer any questions anybody might have.
Yep.
And it's going to be on Thursday, May the 11th. At Char.
Oh, fabulous. Fabulous.
And we'll get some good food.
Yeah.
That's going to be 11:30.
Okay.
And if that one happens to be full, because we are getting a high demand for it,
I bet.
we're going to be having more of them. So just go ahead and call and get your name on the list if you have any questions about anything, or you can contact us at the clinic.
So register, so to speak, because it's probably going to fill up. But this is a really great opportunity. I think you don't get opportunities like this very often to ask these questions like this.
It's one of those situations where we know we're bringing something new. And we want to give people the opportunity to come and field their questions and just discuss it and sit down and spend some time with them, make them feel more comfortable about it.
Very cool. Just out of curiosity, what does the FDA say about this?
Well, the FDA is actually not taking a stance. What they've done is they've handed it over to the tissue banks, such as lifeblood. They consider it a blood product. So the same agencies that regulate the blood that comes through Memphis lifeblood regulates tissue cord blood. And as a matter of fact, my children are 13 and 10. Back then, we were banking cord blood based on what friends that worked at St. Jude were recommending at that time. So it's not, it's new in our area, it's new for some of these procedures, but it's been around for quite a while.
Yeah, you know, it's so funny, I hear people say this oftentimes, things come to different parts of the country and then they lastly come to Memphis, but that, you know, just in the world in which we live. So what about insurance? Does that cover this, or how does that work?
That's a great question, one of the first ones that we get. It is not covered right now by insurance. It is considered a cash procedure. It is less by far than most deductibles overall. But again, when you look at the overall, hey, I've got one injection, I'm not missing any time at work, I'm not having to go to rehab, and you fixed the problem. It's quite impressive what we're able to save them in the long run.
Very well worth it on the front end. All right, let's pop. You can get more information right there. Primary Medical Partners, stem cell therapy. Again, this event will likely fill up very quickly, so you definitely want to reserve your spot to ask those questions and get any questions that you or your loved ones may have about this amazing stem cell therapy. Gentlemen, thank you so much for being with us. We so appreciate it. Coming up, it is Navy Week.